Welcome to Working Smarter, Concise Compliance Conversations featuring Wendy Rubis, sponsored by Village MD, primary care physicians, practice medicine the way you've always wanted, data, resources, and clinical decision support to care for your patients inside and outside the exam room.
Hi, welcome to Working Smarter. I'm Wendy Rubis, General Counsel of Village MD. Today, I'm so excited to be joined by Michael Brady. Michael is a health policy reporter at Modern Healthcare, and he's written for the advisory board company and done other health research and publications. And we're so thrilled to have him with us today. Michael, how are you?
I'm doing great. Thanks for having me.
Well, I'm just so thrilled to have you. And today, what we're talking about is the data, revolution in healthcare regulation and policy, and the way that we've seen in a number of different places, which we're going to talk about, either the requirement to report data or making data publicly available, and how that's impacted regulation and policy, as well as enforcement, and as well as usability to consumers. So we're sort of tackling this as a big subject today. So Michael, as we start the conversation and looking at some of these data sets, it'd be helpful, and I know this is something that you've reported on and are somewhat of an expert on, to kind of get some context for the impact of some of this data and whether it's achieving its expected value.
So just to set the table a bit, throughout the policymaking process, especially in recent years, there's been this constant drive towards collecting more data and making that data publicly available. But while access to data is necessary, it's not sufficient to improving the healthcare delivery system, because patients and providers and payers need access to useful, relevant information to make informed decisions.
So I think it's helpful to look at some examples to kind of illustrate the context that you gave us. And one of the first ones that was a big initiative and pushed for some open data was, of course, the Sunshine Act. For our listeners, we did an episode on this, but because I know all of our listeners have heard that, but just as a reminder, this was passed in 2013. The reason was there was this industry research that was showing that this gifts and incentives from industry was effective in influencing physician prescribing, even if the treatment was less efficacious. So with that research, there was this big push, and industry somewhat supported it. So there's an open source of data now that you can see what is a doctor accepting from various manufacturers and drug companies. And so this has been out there. Now, what's interesting is up until just this past winter, there hasn't been any enforcement. The very first case was just, I think, in November. It wasn't a finding of a kickback, okay, or that it was improper influence. It was just they didn't report out the payments properly. It was a case where a company was paying doctors that owned a restaurant. They were paying the restaurant. So we just are starting to see enforcement. We're told we're going to see more, but this is really one of the early experiments in open data. And Michael, what is your view of this world of data for the Sunshine Act?
So I think the Sunshine Act was a good start in terms of unearthing this relationship between physicians and drug and device makers. But we haven't seen any real evidence that it's significantly affected either payments or patients' relationships with their doctors. The total value of those payments has went up from 2014 to 2019.
I know. Yes.
But I will say that the number of records reported went down. So it seems like there's a smaller number of payments being made, but the value of those payments has gone up.
That is so interesting.
Yeah, and I'm not sure, what to make of it at this point. I think to your point, there hasn't been any enforcement until quite recently. The reporting is done by the drug and device makers. So this isn't something that is sort of really patient focused, and it's not even really all that provider focused, in the sense that providers aren't having to constantly engage with these reporting requirements on a regular basis in the same way they are with other reporting requirements. And I think if it was really impacting providers, we'd probably hear a lot more about it from them, and we're just not.
Yeah. Yeah, I think that's so interesting that the payments really haven't gone down. I mean, I think, what people in providers' offices would tell you is the days of free meals and lots of pens and things are over. But obviously, you're still seeing some of the major payments and things. So, what's really been the impact? It's hard to say.
The evidence suggests that there's a small number of patients that even know about the Open Payments website. So just from that standpoint, you're probably not going to see a lot of consumer behavior change based on the availability of that data. And so even if someone knows about the database, they might not even think it's important, especially if they have a provider that they trust. Because people generally trust providers and especially their own provider, because otherwise they would probably go somewhere else. They're not usually trying to dig up dirt on their providers' payments from drug makers and device makers.
And what would you do? Let's say you go to a doctor, they prescribe drug X, then you go on the website, which, as you're saying, most people don't even know about it. And you go, oh, they're getting a payment from drug X. Well, what are you going to do? Not take the drug? Or do you think, I mean, it's like, it's hard to know what to do with that.
Yeah, and even if you get that far, it's not even clear how many patients could really act on the information if they know about it, because a lot of folks are assigned to, a physician by an insurer, especially when it comes to specialists. And, it's hard to make use of that information absent context when so many of these different decisions are just going to be driven by plan participation and location and the availability of providers and other sort of more concrete concerns rather than this more abstract link between gifts and provider behavior. So, right now, the information seems useful for researchers and journalists, but like CMS hasn't even looked into whether the program's meeting its goals, and it's not. And as I mentioned earlier, it's not something that providers are really talking about.
Yeah.
So it seems like any big changes would be driven by providers and payers. So, for instance, if providers might be less likely to take gifts from medical device companies or drug makers if it becomes difficult for them to establish referral relationships with health systems or join a big health plan. Data sort of just posted on a government website isn't likely to drive any changes unless it has consequences.
Yeah, good point. Excellent point. Okay, so let's move on. This is one of the, I think, more powerful data sets. And we're talking about the Medicare billing data, claims data. I think it's such an interesting story that this was sealed in 1979 by a court, and it remained sealed all the way up until 2013, which I remember vividly when this came out. And I know Modern Healthcare covered it extensively. And I remember I would just constantly want to tell our doctors and the doctors I represented. I used to do presentations and things and go, look yourself up, because it was just such a sea change for a physician to know this information about you is public. And I think to some extent, since 2013, we've sort of gotten used to that. But at the time, it's hard to even explain what a change that felt like for providers. So, what is your view of the impact of this data being public, Michael?
So I think my view of this data being public is somewhat similar to my view of the Sunshine Act and physician payments. We have seen the disclosure, I think, is helpful, and it's obviously useful to sort of figure out who outliers are in terms of provider behavior and utilization, those sorts of things. But they don't fundamentally get at what I think is more of the core issue here, which is sort of fee-for-service medicine and a sort of general trend towards overutilization. And so, it's one thing to identify outliers if your assumption is that most providers in the system are sort of, mostly doing high value care or delivering high value care. It's another thing if most providers are reimbursed on a fee-for-service basis and everybody's sort of engaging in, overutilization type practices, and you're just identifying the most egregious practitioners of it.
Yeah, it's so true. I used to say, this is not a place you want to be first. You know, if you're the highest biller, you're likely to get a call. And in fact, we were talking to the Department of Justice recently, and I was surprised how rich and deep their use of this data is for enforcement. They were even telling us like they have access to this on their computers just at the ready. So I think, but that's like you said, that's really for the high outliers, and it's very evident from looking at them. Like, okay, something's different about them, but it doesn't really have an impact. Like if the trend and the majority of other providers are also overutilizing, it won't tell you that.
No, it won't. In fact, it could even obscure it if you don't sort of control for that.
Right. I see that.
Yeah, so that's something that I'm concerned about. I think the difference that you've seen in enforcement is largely around the fact that when it comes to something like, drug maker payments to physicians, that isn't coming out of the federal coffers, whereas we've seen a lot more enforcement on Medicare payments to physicians, but that's because taxpayer dollars are at stake. So there's a lot more of a government interest in stopping that behavior.
Yeah, so true. All right, well, let's move on. I know something that you've done a fair amount of reporting on, and we were curious and very interested in this as well, is this idea of hospitals reporting payer discounts by payer. I admit that when this was first proposed, I did a podcast where I was waxing on about how I never thought this would become the law. I just did not think this would be final. This is such closely guarded information by hospitals. It is the most closely guarded information that they have about their discounts. And so I know that we took a look at this and you've done some reporting as well. Many hospitals aren't yet really complying with this. But what do you think of this, and where do you see this fitting into the trends?
So I think the information about hospitals' negotiated rates is going to be useful down the line. But, there's the accompanying rule that for insurers to provide the out-of-pocket costs and for their beneficiaries. I think that's really going to be what's most useful for consumers. I think the hospital focused rule is really much more useful for providing information to competing hospitals and other providers, third parties and data aggregators to better understand how much hospitals are charging for certain services. But it's really, in my mind, mostly about boosting competition, spurring innovation, and trying to drive down healthcare costs in the long term. But it's really an open question to me whether the regulation is going to lower costs, especially in the short term, just because increased price transparency sort of lets everyone know who's getting paid what and who's paying what. But to me, that's more likely to just sort of level out pricing rather than bring down total spending, because it doesn't fundamentally address any of the key drivers of cost growth. But by providing transparency, it kind of gives you an idea of what the market rate is, even though in many of these markets, there's a lack of competition. And so the prices are just going to stay high.
Yeah, I think that's exactly right. I do think it may end up with some leveling. What it's going to reveal is the absurdity, and it will surprise people. But is it actually going to change? Other than that, you're probably right about that. I think that's right. And again, there's this open question about, is CMS going to impose penalties? And I think hospitals are being fairly brazen right now in the way that they're not necessarily going to do it unless they think they'll be penalized.
Yeah, I mean, we saw, just recently, there was some reporting showing that a number of big hospital systems are using computer code to block pricing data from showing up in Google searches. And so CMS put out some guidance for the tech folks at insurers to essentially tell them, hey, you guys can't use this code when the insurer-focused rule takes effect next year, and to act accordingly.
And I just know anecdotally, if you're watching along, you can see we have our Janessa and a Sherlock Holmes here because we went and tried to look at websites and we didn't know that they were blocking them on Google search, but just inside of a website itself of a hospital, you had to really look. I mean, it was like really buried to find. So that just goes to, the effect of that it'll have. We'll see. This is going to evolve. I think we're just at the beginning here.
Absolutely.
So moving into one of the things I think that's the most interesting changes that we're seeing in real time is the info blocking rules. And the way I think about this, Michael, is HIPAA was supposed to be create this portability of data, all this talk about administrative burden. And really, HIPAA has become a shield to sharing under the guise of privacy. It's created barriers actually. And so the info blocking rules are really supposed to be designed to allow consumers to get their information however they want it and even download it into an app of their choice so that they're not beholden to the Epic portal or the EMR portal. They can put it into their app of their choice. That's the promise of these info blocking rules. So, to your point, this could be one of the ones that really does impact consumers potentially. How are you thinking about this one?
So I think that's right. Of the things we've talked about, this is sort of furthest along in terms of delivering on the promise of interoperability and more open health information. And in large part because now that information can be used by third parties and it's really put into the hands of consumers, which it really hasn't been before because providers have, for understandably, really been gatekeepers of that information, which can be good in terms of making sure that the information doesn't get into the wrong hands. But I think the sort of overly conservative approach to health information has also prevented that information from getting into the right hands, which is, ultimately the patient and the providers they trust to provide their care. But I think the thing that's a little bit discouraging about that, especially when we look at the other areas that we just talked about, is HIPAA came out in 1996. And folks are finally getting access to that information a quarter century later.
I know.
And Congress had to pass new laws to make the HIPAA law work more or less as it was intended to. And so I think the question is, how long is it going to take for information to become useful? And so far, it's not really going all that great because it's an important regulatory framework for protecting patient health information.
It's just so funny, Michael, because the P in HIPAA was portability. And people think of HIPAA as privacy, right?
Mm-hmm.
It's just so funny how that's just was not really the spirit of that whole schema at the time. But you're right. Now, here we are all these years later, and we've had new law. And, this info blocking law has been greatly opposed by industry, and some of the EMR vendors have been very against it. And in this paternalistic sort of thinking about we have to, spoon feed patients information and things, and in the vein of security concerns as well. So it'll be interesting to see if this actually does break down those barriers or how long it'll take, right?
Yeah, absolutely. Especially because providers and the EHR vendors and some other sort of incumbent stakeholders have very much used HIPAA to engage in what seems like anti-competitive behavior, whether that competition is from other providers or that competition is from other EHR systems or other apps and things like that. And so it's hard to know exactly what the end result will be because the folks who are fundamentally responsible for implementing these policy changes in many respects were opposed to them. And so the likelihood that they're going to put forth a lot of effort to making sure that the rules they opposed work well it seems unlikely to me. But I think the other thing is because it took so long for HIPAA to start working as it was intended, the laws become outdated and so have some of the rules that are written under it. And it doesn't really imagine a world in which there's an internet and there's all this health information like geolocation data or web searches, sort of consumer devices that are tracking health information. So, just as HIPAA is sort of starting to work a little bit more like it was supposed to, it's become outdated and needs to probably be updated and probably requires additional legislation around data privacy, a general data privacy law for consumers that doesn't cover the traditional HIPAA covered entities, but includes Google and Facebook and Apple Watches and all these different sort of devices and services that have a lot of health information or health related information, but are in no way covered by HIPAA. It's a constant game of catch up, I think.
I agree. It's such a good point. I mean, I just remember with HIPAA, we were talking about file cabinets and binders, and it doesn't address all of that consumer data. That's so interesting. So we'll just have to keep an eye on how that's developing. The last thing I think we just wanted to talk about is something that's been in the news quite a bit and people are somewhat familiar with. We've talked about it a little bit on the podcast, but it's the CMS Star Rating system. I think it may have started in the nursing homes. It's now pervasive for many different kinds of providers, including physicians. And the idea here was to give consumers a model for quality so that they could have some guidance in selecting a high quality provider. And reasonable people, I think, disagree about whether that has achieved its benefit. But this is probably the most likely that hits the points you set out for us at the beginning about, is this really useful for consumers? Is it going to drive behavior? This is probably the most likely, I think. Is that what you think?
I think so, because while the star ratings and other attempts to make sort of complex sets of information easily and quickly accessible to consumers so that they can make an informed decision have their faults, certainly. And reasonable people can disagree about exactly how those star ratings are put together and the methods behind them and the data that's used and how that data is weighted relative to other data and those sorts of things. That's all, I think, those are all valid concerns. But I think the general approach of giving consumers easily digestible information that they can use to make a reasonably informed decision is ultimately going to be really beneficial, even if it takes a while to work out the details and figure out models that work well. Certainly, the models that are in place now are not the ones that are going to be in place several years from now, but I think they're certainly trending in the right direction.
Yeah. I read somewhere recently that as soon as you start to measure something, you distort it. And it does happen with the star ratings that once something becomes a star rating, it can be distorted somewhat. But I think it's the best thing we have, at least right now. And I agree with you that they start off very rough and they tend to get refined over time. So I think you're right that will continue.
Yeah, and I think that refinement process is going to be ongoing, and we're going to see annual changes, certainly, on a lot of these things, just because when you start measuring something, as you alluded to, it provides an incentive to game those measures by adjusting your behavior or moving around money or whatever it might be. People start teaching to the task. And so it's definitely a game of cat and mouse, and that's always going to be the case between the regulators and the people they're regulating.
Well, Michael, looking forward into the next several months, what are you looking at in terms of covering of this area, and what are you expecting to see, and what are you looking forward to?
I would say the big things I'm focused on right now are the hospital negotiated payer discounts, how the Biden administration enforces the posting of that data and the guidance that they issue in response to some of the behavior we've seen from providers and we're likely to see from insurers. And I think the other thing that I'm really interested to see is what happens with some of these proposed changes to the HIPAA rules that are designed to encourage providers to share information. Comments on those rules were due, I believe, last month, and the Biden administration pushed back the due date to, I believe, the middle of next month or early next month. And so I'm interested to see how the industry responds to those proposed rules and how the Biden administration responds to stakeholder feedback. I fully expect the Biden administration to move forward with some version of those rules, but there could be some significant tweaks before they go live.
Yep, I think that's right. Well, I've so appreciated you coming and sharing your insight with us. We love following you and the work that you do at Modern Healthcare, and just really appreciate your thoughtfulness about this important topic. We're so interested in this here at Working Smarter. We're always looking at these trends. So thank you so much for joining us. And I hope you'll come back sometime and check back in with us about how these things are evolving.
Yeah, absolutely. I always love talking about healthcare policy, especially during the implementation phase, because that's usually where a lot of people check out. And I think that's where the interesting stuff starts to happen.
Agree. Thanks so much.
Thank you to our sponsor, Village MD. We hope you will join us for future concise compliance conversations.